Good evening, everybody. Welcome to YouTube Live tonight. I'm Dr. Howard Elkin, the medical advocate, and I'm so pleased that you're able to join me tonight for part two of a two-part series. Now, if you recall, 2 weeks ago, we started with the ideal cardiac diet. Well, is there an ideal cardiac diet? And those of you that know me know that I'm not a one-size-fits-all kind of person. And indeed, we discovered that there really isn't an ideal cardiac diet or an ideal diet, for that matter, for anyone, because there's just too many variables. There's, besides heart disease, there's diabetes, there's cancer, there's kidney disease. Are we talking about performance? Are we talking about lifestyle? Does the person travel? Are there food sensitivities or food allergies? Are we talking about longevity and or energy and performance? So there's so many variables that you really have to take into consideration before you select an ideal diet. And to me, an ideal diet is one that's healthy and which suits the particular individual. So it's a customized kind of thing. Now, 2 weeks ago, we talked about the Mediterranean diet and the paleo diet. And the Mediterranean diet, as you might recall, is the most studied of all diets out there. And it really came to light back in 2013 with the publication of the PREDIMED study. And that was a large study based out of Spain. And they had three groups of patients. The first group was Mediterranean diet with olive oil. The second group of patients was Mediterranean diet and nuts. And the third group was basically a low-carb diet. High-carb, low-fat diet. And what they found is the first two groups, the true Mediterranean diets, had about a 30% less chance of dying from a cardiac event, which is really noteworthy. That was really the first primary prevention trial in which was actually showed a decrease in mortality. It wasn't the first study on the Mediterranean diet. The Lyon heart study, and several years before that, was a study much smaller in scope and the number, and it looked at patients that had previous disease, and they also found a survival advantage in those, and by being on a Mediterranean diet. Then we switched over to paleo diet, which basically is, if it doesn't run in the wild or grow naturally, it probably doesn't belong on your plate. And that's a very popular diet these days, and makes a lot of sense. Unfortunately, the research is not nearly as extensive as it is on Mediterranean. But tonight, we're going to talk about two different extremes. One is basically the vegan diet, and then the ketogenic diet. So talking about vegetarian, basically it's no meat, right? There's different types of vegetarian diets, and I have to always look at my notes because I can never remember these. Okay, so dairy and eggs is lacto-ovo. Eggs but no dairy is ovo-vegetarians. Fish is pescatarian. And vegan is really no animal products whatsoever. And that's really what we're going to focus on. And the important thing here is that this vegan diet is really increasing in scope. In 2014, there was about 1% of the population in this country was actually going vegan. Now, the last count in 2019 showed that it's up to 2 to 6%, depending on what you read. So that's really more than double, right? Tripled. It's quite a increase in just a few years. And also, if you look at the number of plant-based products out there, the sales have totaled like $4.5 billion in the last year. So that's an increase of like 30% from 2017. So it's definitely on the rise. People like it. So what are the reasons to go vegan? Well, there's also your animal rights activists. And we won't go into detail there, but that's always probably a very big reason. Also, a lot of people feel that it's safer for the environment. And they look at this greenhouse emission thing. And I don't know how well established that is, but that is an argument that true vegan proponents go for. Then there's also spiritual beliefs, ethical beliefs. This is what we should be doing. And people that actually have a strong spiritual backing for a vegan diet are the most likely to stick with it. And also, what about health? I mean, we're really here talking about health. And there's some studies that show that, yeah, you can decrease your cholesterol, your LDL cholesterol, the lousy cholesterol. Your blood pressure can be decreased, your blood sugar. So there are some definite health benefits of going vegan. And another thing that I really like is that it does seem to have an increase. People that go vegan generally have a larger intake of antioxidants, which is really an anti-inflammatory diet. Fruits and vegetables is the mainstay. So that's really a good thing. And it may promote greater self-control. But then again, Any set diet can do that. You don't have to go vegan. Any set diet, it requires self-control. But what about the pitfalls or the disadvantages? And one is that it's a radical change. I mean, to go vegan is no simple matter. You really have to commit to this. And it's a potential interference with other coexisting comorbidities or diseases, like, for example, osteoporosis, since there's a lack of dairy, which is a big source of calcium, okay? And also diabetes, because a lot of vegan diets are very strong in carbohydrates and grains, which may be good on one level, but may not be so good when it comes to diabetes and prediabetes. Also, difficulty in dining out. I don't know if that's really a problem in Los Angeles because there's a new vegan restaurant popping up everywhere. But I think in most of the country, it's a little unusual. It's a little difficult. What concerns me is the loss of essential vitamins and minerals, and B12 is probably the biggest one. B12 is a B vitamin, and it only is obtained from meat and meat products, animal products, and if it's allowed to go on for years and years, you can develop severe neurologic damage. So it's important that you take B12 supplements if indeed you are vegan. There's also loss of minerals such as iron, very important, calcium, and also magnesium and zinc. And that's because I think we talked about this a couple weeks when we talked about the myths about a lot of grains are very high in phytic acid. And that in itself can decrease the absorption of some of these minerals. Remember, this diet pretty much leans heavily on the use of grains since we aren't talking about meat. So that's important. There's also unrealistic expectations that this is the end-all be-all diet. And those of you that know me know that I'm not an end-all be-all kind of guy. Although there are some good data, data isn't fantastic. It's never been shown that this is the best diet for overall health, despite the claims that you may hear. What I concern myself with also is protein deficiency. Now, we need protein for every cell. It's the building block for every cell in your body. I mean, every cell. And there's no question that vegans tend to have lower intake of protein than your average individual. So protein is important not just for muscle mass, but like I said, it's for every cell. And it's really few complete sources of protein that are plant-based. There's a high dependence on soy. And most soy that's eaten out there is really it's really processed soy. If you're going to get unprocessed soy, you have to go to like an Asian market. Most of the soy available out there is processed, and there's a lot of negative press about soy these days. Like 20 years ago, it was like a health food, right? It was a big thing. I used to get this newsletter called The Soy Connection, and that went out of business. But soy also has detrimental effect. It can be a hormone disruptor. It can actually disrupt your hormone balance in both men and women. And although it may be safe, it may also be a causative factor or aggravating when it comes to cancer, prostate and breast cancer. So I'm concerned myself with that. Also, another big source of protein for vegans is legumes. And a lot of legumes, because again, there's very few complete sources of protein. A lot of legumes can irritate because of the lectins and the phthalates. It can actually lead to increased gut permeability, leaky gut, and a whole host of GI problems. There's also a risk of anemia because, again, because of lack of iron. This is really a concern of women in childbearing age and also lactating women. And also a possible depression. There's a depression that's possible because there's usually these people have less in the way of omega-3 fatty acids. They're not eating fish. So that's another problem in itself. And it's just too many carbs. I mean, the reliance on legumes is pretty extensive. And you don't have to have legumes. You can have rice and beans and other things, but it really, to get enough protein in, you have to really have a lot of legumes and soy. And it's a large amount of carbs, and that's not going to do well with your diabetic population and in longevity and overall. We don't need but so many carbs in our diet, and it can lead to disordered eating, or this new term called orthorexia. That can happen with any kind of diet that is just so strict. Now, I knew a person. She was vegan. She was lectin-free, she was histamine-free, she was sulfur-free, she was dairy-free, and she wanted to have the healthy. She was miserable. She felt horrible no matter what she did. She had osteoporosis. She had hip replacements done before she was like 40. Didn't have a period for like 25 years, and had a host of other problems. So disordered eating to this extent is very detrimental to your health. And as far as longevity, now there was a report in the Huffington Post a few years ago that vegans on the whole live 8 years longer than your average population. Now, I don't know how well founded that was because I tried to find the research based on that article and I couldn't find it. And another thing that interested me is that they compared it to the standard American, well, they said average population in this country. And you and I both know that the average population in this country ain't healthy. So that's not where I would want to be compared to. Now, let's switch over to the ketogenic diet. The ketogenic diet it's a big thing these days, but it's not a new diet. It's been around since the 19th century because it was used to treat diabetics way before we had insulin. Then with another resurgence in the 1920s, last century, for controlling epilepsy in children. And it still has a role there, by the way. But recently, it's had more of a resurgence for weight loss, for treatment of diabetes, metabolic syndrome, cancer, and Alzheimer's disease, which we'll get into. So how do you define it? There's different definitions of ketogenic diet, but it's always going to be a high-fat, low-carb diet. We're talking high-fat, usually 70 to 80% of your calories is from fat. It's considered a moderate protein, not high protein, moderate protein, so maybe like 20% at the most would be protein. And then it would be very low carb, maybe 5 to 10% of carbs in the diet. So here's the premise behind the ketogenic diet. So what happens is that you start depriving yourself of carbs, and your body is going to then your liver is going to start to work harder. It's going to pull as much sugar as it can to the point in which there's no more carbs, and the insulin level will go way down. And that's when the whole process takes place. And the liver will make something called ketone bodies. And ketone bodies is another great source of energy. You don't have to have carbs for energy. We think you do, but you don't. Ketone bodies are very good for the brain, and actually it's a great source of energy. So the goal in a ketogenic diet is to go into ketosis. And if you follow it correctly, it takes about 3 to 4 days, depending on how strict you are and how well your body adapts. That's the basis behind it. But again, the macronutrient distribution can vary depending on what kind of diet you're on. You can have as high as 50 grams of carbs, which sounds a lot to me if you're ketogenic, and as low as 20 grams. So 20 to 50 grams of carbs is a general range. 70, 80% fat, 5 to 10% carbs, and about 10 or 20% protein. Now, benefits. What are the benefits of going ketogenic? Well, first of all, fat is very satiating. I mean, how much fat can you eat in one sitting? And yet carbs, we just want more, right? How much pasta or rice can you have? You're not going to just have a whole cup. So it's a difference in satiation. Also, it's a decrease with ketogenic, there's a decrease in your appetite stimulating hormones like insulin and ghrelin. So those are less available, so you're less hungry in general. Also, ketone bodies themselves have a depression on hunger. And it does promote fat loss because you're not eating carbs. The insulin level is low. Insulin is essential for life, right? But it's also a fat storage hormone, which people don't think. That's why when patients have to go on insulin because their diabetes is so poorly controlled, I say I shift them off to an endocrinologist because I don't like dealing with insulin. It's a host of problems, and it's not great for the heart, and it promotes fat storage. Pitfalls. It's a challenge to maintain, like the vegan diet. Yes, it's a very strict kind of a diet. You have to maintain it. It's not easy. And you can have mood changes, fatigue, irritability, headache. There's a phenomenon called Keto Flu, the Keto Flu, which can happen when you initiate this diet. And some people get it more severely than others. The way to overcome it is to be very well hydrated, and also to have ample amounts of salt. Okay, this is a diet that you need salt. There's also a question on, does it promote kidney stones? Does it promote uric acid production, which could lead to gout? These aren't terribly well answered right now, but there's some speculation that it can lead to that. And there's also a micronutrient deficiency, which is key to any special diet. So what we don't know, what are the long-term effects of going ketogenic? It sounds like it's got some really good stuff. It does help with weight loss. It can be very useful in cancer because, as you know, cancer thrives in the presence of sugar. So there's no sugar. It's also, I think, a great diet for aging because the brain thrives in the presence of fat. The brain is 65% fat. So it makes sense that it thrives in the presence of fat, whereas carbs actually increase oxidative stress in the brain. So carbs is really not good for the brain as we age. And I don't know about you, but I don't want a good heart with a bad brain. So it's very important that my brain is fed good nutrients. We also don't know how risky it's in the elderly population and also in high-risk patients that have like kidney disease and other long-term health comorbidities or other illnesses. Now, people ask me, well, how long should I go on this diet or what can I do? And I don't care if it's vegan, but definitely ketogenic, you need to try it for at least 12 weeks. Do it strictly for 12 weeks. And in many cases, I would suggest even going 6 months. And then if you've achieved some goals with weight loss and so forth and so on, then you can alter it and you can cycle your maybe go 3 days in ketosis, go out of it for a day. I don't mean go out and eat pizza and and all kinds of high carb foods, but liberalize your carb intake for a day or so. And I think that adds a little variety to the diet because carbs do add that sense of variety and also just variety and taste. It's I can't think of the right word right now, but so you can once you've achieved some benefit with this diet, it's not a bad diet to cycle. So, okay, that's what I have to say about these diets. And now I'm open for questions. So please, if you have any questions about these diets or diets in general, please enter them in the chat box. Okay. Well, I have a couple here. So a lot of people ask me, is vegan truly a healthy diet? And because of what we talked about, but it can be, but a lot of vegans that I know are very high on processed foods because you can go to the co-op and you can go to these places and get things with bags and boxes, which we know is processed. And so it doesn't exclude sugar and gluten, okay? So if you're concerned about sugar and gluten, you have to have a well-balanced vegan diet. And a lot of diets out there that are vegan are not necessarily well balanced. It's really important. What about fake meats? Well, fake meats are processed and they're not necessarily healthy at all. So I'm very weary of these fake meats that are out there, and they're getting very popular now. These look-alike and taste-alike burgers. They're very processed, and I would stay away from them. We talked about soy, that is, it's processed, but here's the thing. Soy could be an endocrine disruptor, but also, which I think is important, and contribute to cadmium intake. So then you got heavy metals to worry about. So there can be a heavy metals association with soy intake, which is a big staple in the vegan diet because it's one of the few really complete proteins we have. Now, what about nutrient deficiencies? That's a question I'm always asked. And I don't care whether it's vegan, whether it's ketogenic, or even the new diet out there, which I didn't really go into, called Carnivore Diet, which all you eat is meat. That's it. No meat, no vegetables. And these people feel that you don't need to have polyphenols. You don't need to have everything you need in life is from meat. I don't necessarily believe in that, but I do believe there may be a role in carnivore diet for a few weeks because it does help to heal the gut. Most of the problems we have with gut permeability and irritation, it's propagated by eating too much gas, cruciferous vegetables. Vegetables actually cause gas and irritation. Fermentation is another problem. So sometimes going a few weeks with a carnivore is not a bad idea. But any of these diets, I don't care what they are, but if they are very exclusive, like ketogenic and like vegan, I do recommend after about 3 or 4 months or so, after being on it for at least 6 months, that you get a special test, a nutrient, be looking for micronutrients. Now, you won't get that from Quest or LabCorp. You have to go to a specialty lab, and there are several that we use. I'm very fortunate in having a nutritionist on staff at HeartWise, but we really want to check and see what's happening at the cellular level. Magnesium, vitamins, that's really important, because I guarantee you most of these diets that are super selective like that are going to be very deficient in micronutrients. So what is a common link between vegan diet and ketogenic? There's something common. One is micronutrient deficiencies. The other is social isolation and disordered eating. We talked a little bit about that before. It doesn't matter whether it's vegan or whether it's ketogenic, but usually that's going to exclude who you associate with, which has already been a problem in the last year with COVID, right? But we really want to, it promotes isolation, and this is what I eat, and it's not ideal by any stretch of the imagination. Another question I get is, what about, can you have any fruits at all on a vegan diet? And most fruits are out, for sure. However, you can have, ketogenic diet. I made a mistake. And yeah, on a ketogenic diet, you can't have fruits. You can't have any starchy carbs, starchy vegetables like corn. It's out. Not that you want to have corn anyway, but you can have low glycemic berries, cherries, and very small amounts. Those are very light glycemic. They have a very low impact on increasing your insulin level. What else? Okay, here's another great question I've had. How does the ketogenic diet differ from like diets of a few years back, like Atkins, which was a high protein diet? Keep in mind that this diet is not a high protein diet. It's moderate protein. You don't want too much protein as you would in Atkins, because what it does, it actually prevents ketosis. Your body can actually take too much protein. It's called a gluconeogenesis. They can actually take protein and convert it to glucose, which is the last thing you really want, right? If you're trying to go into ketosis. So that's why it's important that the protein level be monitored, but it really should be no more than moderate. It is not a high protein diet like Atkins and some of those other diets that were very popular a few years ago. Looks like I don't have any questions. And I get this question also about, what about legumes? Now, legumes is another staple in the vegan diet. And, you've heard about this Dr. Gundry and this whole thing about lectins kill you. They're horrible for you. I think legumes, which have lectins in them, legumes can be harmful if you eat them excessively, which is often the case with vegan diets. There's also ways of decreasing the effect on your gut. That's by soaking them. There's different, by fermenting them, soaking them, germinating them. There's different cooking methods you could use to mitigate that negative effect on legumes forming lectins. So I don't agree. Most people don't agree with him that it's like it's like a poisonous food that destroys the gut. It can if you do it haphazardly and you have too much and you don't know how to prepare your legumes properly. Now, I don't even know if this is working because I haven't had one question tonight. Let me see if this is working. I can't see the chat box. Wait a minute. Let me see. Hold on. This has never happened before. So someone told me there's something wrong here. Give me a second. Unbelievable. I was wondering why I had no questions. I was just making it my own. I'm just, okay, I'm going to come back on, guys. So, because maybe there's obviously a problem here. So I'm going to hang up for a second and get back on. So please stay with me. I'm going to restart it because something happened here. I don't know what happened. Okay.